It's really a pleasure to come back to update the committee on the administration's comprehensive response to the H1N1 virus and discuss the impact that the pandemic is having on work, school, and society. We have estimated that the first 6 months of this pandemic, the virus has led 22 million people to become ill, 98,000 people to be hospitalized, and about 4,000 people to die. The virus is spreading widely in 46 states. It's beginning to decrease in many places, but it is still way higher than baseline for this time of year. So far, there's been no change in the illness pattern, the age pattern, or underlying conditions. 90% of people who have died from this virus are under 65 years of age, a complete opposite with what we see from seasonal flu. 2/3 of the children who have died have underlying conditions, asthma, neurologic problems, and so forth. And so we know that pregnant women, adults with chronic medical conditions are at higher risk than others. So far, there's been no change in the virus. This is good news because it means it hasn't become more virulent. It's also good news because the vaccines that we're making perfectly match the strain and should have good effectiveness. But influenza, including the H1N1 virus, is unpredictable, and we do not know the trajectory that the virus will have in the weeks and months ahead. We know that previous pandemics have had multiple waves, and we are mindful that disease may continue to spread and that we may have waves of this disease through the next several months. The typical flu season goes from December to May, and we are mindful that we have a long road ahead. CDC's role I'm going to go through in a little bit of detail, but first I want to thank Congress for the incredible support that we have received to strengthen the preparedness of the country. It really is a little terrifying to think of where we would be if we had not been investing in the past several years in improved preparedness at the state and local level, the federal level, and the global level. CDC responded promptly last fall, identifying and characterizing this new virus, developing a strain to form a candidate for vaccine development, carrying out epidemiologic and laboratory surveillance in the U.S. and around the world. Our response has been comprehensive and aggressive, using science as the base for our approaches. We rapidly deployed assets, including life-saving antivirals and a significant portion of respiratory protection from our strategic national stockpile. We prepared and shipped laboratory kits to states around the country and to over 150 countries. We sent field teams to assist at home and abroad. We've issued guidance for schools, businesses, and so forth, reminding them about how important sick leave is. We've issued guidance and updated that guidance for healthcare workers, mentioning respiratory protection and the steps that could be taken to extend the supply of respiratory protection. We've incorporated new antiviral medicines that can be delivered intravenously with the help of the FDA. We've focused on communication and we've focused on vaccination. We're in the midst of a large national voluntary vaccination effort that is unprecedented in its scope. We, like others, are disappointed in the vaccine production and have been, to some extent, the victim of a slow-growing virus. But production is accelerating and substantial amounts are now becoming available. Today, 48.5 million doses of H1N1 vaccine have become available for the states to order. They have prioritized groups at highest risk to receive the vaccine during this phase where it's in limited supply, and we are supporting states and local authorities to make the best decisions about how to reach the priority groups with this scarce vaccine. We think it's very important to use vaccine as soon as it's available, as effectively and efficiently as possible. We are focusing on safety and not taking any shortcuts either in vaccine release or in monitoring safety as the vaccine is in larger scale use. Working hard with our partners in HHS and beyond to focus on the state and local infrastructure that's so vital in our response. Today's hearing highlights the human and economic impact that influenza has, and in general, illness really can cause work loss and threaten business continuity. Our guidance is for individuals to stay home when they're sick. 24 hours after a fever is gone is what we've recommended based on updated evidence. We know that we've issued guidance to businesses to be flexible in sick leave and make it easy for workers to do the right thing. It's important to have the right policies in place and have careful planning for contingencies at businesses. Our goal in public health is to make it easy for employees to make the right choices, to stay home, avoid infecting coworkers, and recover. I look forward to regular communications with the public and Congress and to answering the questions that you have.